inspired you to take up this bariatric surgery field?
During my childhood, I was the most obese kid. So I had interest in obesity. So I thought, why not we treat people who are obese and who has a lot of struggle losing weight? And that is how I chose this branch. And when I started, there was nobody except one senior surgeon, Dr. Dhore Patil, who was doing open surgery in Pune. And there was nobody in the country who was doing laparoscopic. So I took a challenge and I started a specialty in the country.
Any specific parameters which you track post surgery, which is very important so that weight regain doesn't happen?
See, my major focus is protein and muscle mass. So we do regular body composition analysis wherever they are. So I told my friend when we are traveling together, we went to our airport lounge and we both did our body analysis. And he is 9 kg lower than me, same height, lower BMI.
As you mentioned, sir, that there are pan-India devices available wherein you request your patients to go and just do their testing. What we came across is your health lounge, which is India's first health lounge on Ahmedabad Airport. Would you like to tell us a little bit about it?
So this was just a story I was just sharing with one of my friend who was influencer to the airport. I said, I want to do body analysis of people who are passing through the airport and that too free of course. He said, usse kya hoga? Let us do something beyond it. So we decided to buy the InBody composition machines 970, which is the topmost machine in the world, which is installed there at Ahmedabad Airport.
Hello everyone, welcome to Inbody Charcha. I am Dietitian Sakshi. Today we have with us the pioneer of bariatric and metabolic surgery in India, none other than Dr. Mahendra Narwaria, sir. Sir, we are extremely honored to have you here on our first podcast of Inbody Charcha. So let's start with your journey, sir. What inspired you to take up this bariatric surgery field, and uh, how did it all start?
Regarding bariatric surgery, when I was studying, I wrote an essay on obesity surgery during my MS, which is a chapter. So I could write for 2 hours during my MS period. When I was doing my GI surgery at Lucknow, SGPI Lucknow, I could read a complete book on obesity surgery. Those days, even bariatric surgery word was not coined. So when I was studying that book, I realized there must be something being done worldwide. If somebody is doing in India, I would like to start this. And it is more important because during my childhood, I was the most obese kid. So I had interest in obesity. So I thought, why not we treat people who are obese and who has a lot of struggle losing weight? And that is how I chose this branch. And when I started, there was nobody except one senior surgeon, Dr. Dhore Patil, who was doing open surgery in Pune. And there was nobody in the country who was doing laparoscopic. So I took a challenge and I started a specialty in the country.
So it must have been so difficult. Starting something from scratch, which is not even very much famous or people are not aware about it. From that journey to AB Plus, your venture, would you like to tell us a little bit about AB Plus?
So when I took my first training in France with Dr. Deluc, it took, and when I came back, when I started talking about this surgery, nobody was ready to listen. Nobody was believing that this is possible. Even obesity surgery is possible. So when I started talking to people about weight loss surgery, they said, no, we are normal people. Why should we get surgery? And it was really difficult. It took me almost 1.5 years to put my first patient on table. And that to a foreigner who came from US, he just, I want a gastric bypass. I said, nobody does gastric bypass in my country. I can do only gastric band. And that is how I did first gastric band. Those days even band were not available. So I borrowed it from my friend again from Pune who had it because it was not launched in India before that.
So, sir, you have a lot of firsts through your names. Just now you mentioned about the first gastric bypass, sleeve gastrectomy, then about hybrid nodes as well. So, starting all of this, and one thing which we just came across was the Sabu-Narwaria paradox, which is a lot in the limelight right now, and we don't want to know more about it.
So Dr. Bansi Sabu is my close friend, and we almost stay together almost every day. We go to gym together, we go to a club together, and since last so many years he lost significant weight, maybe more than 20 kg. So once 2 months back when we were going to Kerala for a conference, my topic was on BMI. The BMI is dead, why we are still using it? So I told my friend when we are traveling together, we went to our airport lounge and we said, let us do our analysis. So we both did our body analysis, and he is 9 kg lower than me, same height, lower BMI, but his parameters, metabolic parameters were non-normal. His body fat percent was higher than me, his muscle mass was lower than me, and he had more metabolic complication, and including the phase angle was not good. It means the cell health was not good. So that motivated. So we then did AI analysis of her body composition, and then we came to conclude that he need more workup on his metabolic health. So I started him on a regular gym. So we are going every day to gym. We want to increase his muscle mass. He started taking more protein. Early days he was only using one exercise before joining this gym, nodding his head like this. No food, but that is not important. We should eat also to maintain our good protein intake.
Correct. Sir, this is the first time when doctors themselves are doing some intervention and themselves taking measures that yes, if we are preaching something, first we should do it for ourselves. Sir, any specific case study or any specific patient which you remember who had a milestone that initially he was, say, a certain number of kgs and post surgery, it was a miracle that he has gone down to some other weight?
I have plenty of them. I've done more than 10,000 such surgeries. But I just remember a recent case wherein a patient came, called me, you want to get this surgery done in emergency. So she came to hospital, I wasn't around, but when I came back, I saw her oxygen level was only 70%, means she was not fit for surgery. When we did body analysis, her excess of water was significantly high. It was so much. And when I was palpating his abdomen, it was stony hard, means we can't even do laparoscopy. So I started on oxygen. We were not able to increase from 70 to 80%. We started BiPAP. Then also it was difficult to reach above 80%. Then we started reducing her edema fluid by starting albumin and diuretic together. And within 3 weeks, we could reduce her 20 kg water intake content from the body by only medicines and diet. And then we made her fit for surgery, and we could perform surgery after 3 weeks. And she was only 26-year girl with 2 kids. If she would have died because of this, if this intervention was not done, I think it was a major. And in fact, she was not even able to afford the surgery, but we still did it without any cost. So it is, saving life is more important than anything else. So we could save, and that gives more happiness.
Absolutely. So just listening to it inspires us a lot. Speaking about now, just we spoke about pre-surgery, how certain parameters like extracellular, what are important pre-surgery. Any specific parameters which you track post-surgery, which is very important so that weight regain doesn't happen?
See, my major focus is protein and muscle mass. So we do regular body composition analysis wherever they are. In country, we know the centers where the InBody is available because of your network. So I ask them to go to the center, get body composition analysis, and then we do Zoom consultation with them. We analyze body composition. We focus more on protein intake and exercise, so that they should not, with weight loss, they should not lose their muscle mass. See, any weight loss method will have more muscle loss and with fat loss. So you can always gain your fat back, but not the muscle. तो जब भी वेट लॉस करते हैं तो हमेशा ध्यान रखना चाहिए कि इट इज़ नॉट only fat which is going, which is muscle which is also going. So you need to monitor it by body composition regularly. Like I have certain people who are on medical treatment, the newer medicines which are weight loss medicines. So we call them every week to my center, do body composition, and then change the dose of medicine according to their need. So anybody who is losing muscle mass, we will not continue the medicine or will not escalate the dose. We ask them to take more protein, do exercise, maintain muscle mass, and then come back to us. So it may take more time, but it is very important because they lose weight which is healthy.
Sir, absolutely. Listening to all of this, how important do you think is a nutritionist's role in this complete process?
I think nutritionist role is much more than me. I do surgery only. The nutritionist follow them regularly. So we have about 6 nutritionists in our team. So they keep calling them. They take their dietary recalls. They ask them what they are eating. We send them protein. We send them even recipes sometime. That these are the recipes which have more protein. So I think dietitian role is very, very important to maintain and lose weight both.
As you mentioned, sir, that there are pan-India devices available wherein you request your patients to go and just do their testing. What we came across is your health lounge, which is India's first health lounge on Ahmedabad Airport. Would you like to tell us a little bit about it?
So this was just a story I was just sharing with one of my friend who was influencer to the airport. I said I want to do body analysis of people who are passing through the airport and that too free of course. He said, "don't know उससे क्या होगा? Let us do something beyond it." तो हमने he asked me to start he said, "I'll give you a space, you create something new." Then I started searching, so we decided to buy the InBody composition machines 970, which is the topmost machine in the world, which is installed there at Ahmedabad Airport. So people who are waiting there, instead of eating vada pav or taking calories in some other form, it is better to bring them to the health lounge, do certain analysis. We do body composition analysis, we do hair analysis, we do skin, eye, heart, and many other tests which are being done. So if they know about their health, we always warn them. We ask them to do their Zoom consultation with us. So we analyze their report and then we give them feedback that this is what is required for you. Recently, I have the press reporter who traveled from Delhi. He just passed through and he sent me his reports. So I said, let us talk on Zoom. And we discussed on Zoom about the body composition. His muscle mass was only 26 kg. Ideally, if he's of my weight, my age and my height, he should be having more than 36 kg. So I said, your muscle mass is more, your fat percentage is more than 36%. That means you have risk of metabolic disease. So better to start working now. You reduce your fat percentage so that you can avoid disease like diabetes, blood pressure, cholesterol, and even heart disease.
Absolutely, because that becomes the root cause of all these comorbidities, which people don't understand at times. They look at body composition as it is maybe just a gym equipment, which is telling you that this much muscle you have to gain, this much fat you have to lose.
Yeah, in gym also it is not being used so frequently. I've been to so many places. We have one launched at our Rajpath Club also, but people don't use it regularly to even analyze their body composition. And maybe I think there's nobody there to even tell them this is how we should analyze. So you need to educate people how to use this machine, and we can avoid many diseases which are linked with the fat percentage only.
Absolutely, sir. So this initiative of InBody Charcha was to spread awareness regarding body composition and its comorbidities, which are a lot for obesity. Um, Lastly, sir, we have spoken a lot about bariatric surgery. Then, how is tracking important for specifically how patient can get progress more and more? If we finally look back and just if I have to ask you one question, what keeps you motivated to keep innovating and thinking that yes, I want to experiment with new technologies, I want to update myself?
I think a surgeon or doctor is only good when he's updated with the technology. It is always hand in hand. You can only grow when you adopt a new technology. If we don't learn AI now, AI in health, maybe we'll be outdated very soon. So our machines can learn AI, why can't we learn it? Similarly, if you can adapt to a technology which is available worldwide, which is best in the world, why can't we use it? And it always pay back. So I must be having almost 5, 6 InBody machines in my old centers, and we are using it. So I never regretted that I invested so much only on InBody machines.
Absolutely, sir. As far as I know, you are also using InGrip, which is a sarcopenia detector. Then we are also using blood pressure monitors, combined it with BCA, which is combination of all devices together. After all of this discussion, sir, there are a lot of initiatives which are there from your side. Would you like to tell us a little bit about your new projects or initiatives and any future plans as such?
See, my major focus is to create a healthy lifestyle and healthy life or healthy citizen in the country. So we nowadays even a lot of new medicines which has introduced in market which are weight loss medicine. But we need to monitor these medicines. People are just taking without even doctor's recommendation. They are just buying or taking from the friends and relatives, and these medicines can cause loss. So we need to create awareness about it. So we are having public awareness program on Sunday about how to use these medicine, what precaution we should take about it, and we have complete panel discussion from people all over India who are coming from different part of India. So that is one. Number two, we are starting a new vertical or medical weight loss program, wherein the diet, exercise, and medicine, all three will be combined, so that we can have supervised weight loss with the help of this medicine, wherein we can reduce about 15 to 20 kg weight without surgery also. So we are creating a new centers which will have weight loss without surgery. So till now, people were just thinking that I'm a bias because I'm a surgeon. I always think about obesity surgery. So it is not true. Actually, those who can do well, we can advise them medicine and diet also, wherein they can lose weight significantly with the help of newer anti-obesity medications.
Okay. Sir, any ideas which you have that we can do certain researches using maybe the medication impact, because people are randomly taking certain weight loss medications right now without proper background research. Do you feel so?
So we are doing research, we are doing analysis of body composition analysis, we are prescribing medicine, we are checking their diet every day. So we have dedicated dietitian only for people who are taking only these medicines, so that every day they'll send their diet to us, so we can calculate their food intake, what proportion of carbs and proteins they are taking. And then every week they have to do this body composition analysis. If they are from Ahmedabad, we call them to our center. If they are not in Ahmedabad, we can always tell them to go to different center where the body composition analysis is available, so they can send those reports. And we will continue medicine only when they are losing fat and not the muscle. Otherwise, we will not change the dose of medicine.
Okay, sir. So, lastly, would you like to give a message to the audience, like a person who is maybe just overweight or obese and is completely given up that, okay, I am done with this weight, what to do? I don't know. So, from a doctor's perspective, a message.
I think obesity is a disease which should be treated like any other disease. Like we go to diabetes specialist to treat diabetes, we go to heart specialist to treat heart disease. Similarly, obesity can be treated with due precautions. So certain people will fall in only medical weight loss. Some people may need endotherapy with medicine, and certain people will need only bariatric surgery. So we can guide them, change their lifestyle, changing their weight, and they can lead a healthy life. More important here is, it is not only changing one person's life, actually the whole family's life also gets changed. The person can play well with their kids, he can enjoy a good life with his family, wife and parents. Parents are happy because he is healthy and he is not unhealthy. So I think these are very, very important parts which need to be taken care during treatment.
Okay, sir. Thank you so much for giving us your time. And we have had a lot of insights, a lot of myths are cleared, a lot of more information is given in this podcast. We look forward to seeing you again in one of our next podcasts. And yes, please like, share, subscribe to our channel. And to see more of such content, please do follow us.